Does your child have an upcoming checkup with their pediatrician? And are they about 18 months? If so, then your child's speech and language skills may be an important topic of discussion at this visit. Here are 10 crucial signs of a potential speech or language delay so that you can identify them early and get some support if needed. But parents, before you start worrying about whether your child is saying words or the right amount of words and checking off those milestones, it's really important that you understand a few things. In order to say words, children first need to understand words and be well engaged, interested, and responsive to the world around them. Not understanding words or not having some of these other aspects can be a reason that children don't use words yet. So the first sign is if your 18-month-old doesn't seem to know or respond to their name yet. This can demonstrate to you a gap in your child's understanding of language. There are some tips and tricks for helping your child learn to respond to their name, so if this is something that you want to learn more about, then check out the video down in the description. Number 2 is if your 18-month-old doesn't seem to follow directions. Maybe you tell them, clap your hands or pick something up, and they just don't do it. They just look at you like they're trying to understand, or they just ignore you altogether. Well, it's probably not that they're ignoring you. It's probably that they don't understand the words you're using when you tell them what to do. This is a sign that there is a delay in their receptive language, which is their understanding of words. And no, we don't expect them to listen and follow directions 100% of the time. Sometimes children just don't listen. But if you're using common and familiar words and phrases that are in the context of their daily routine, it could indicate that there's a lack in the understanding of the words that you're using. To help your child with this kind of receptive language or understanding words to help them listen and follow directions, I have an entire video to help you do this, and I highly recommend checking it out. The link is also listed in the description down below. Some simple commands and directions that we would expect an 18-month-old to be able to follow through with are get your shoes, or clap your hands, or point to your nose, simple things like this. It's very common for a child to understand way more words than they actually produce themselves, sometimes even up to 10 times more words that they understand than they're actually using. They also learn words at such a rapid pace at this young age. So if you find that your child is having a hard time understanding new words every week, then this could indicate that there's some difficulty with their receptive language and understanding words, which would of course undermine their ability to actually use words themselves to communicate. The next sign is if your 18-month-old doesn't seem to understand consistently the go get your command. Again, this is a very simple command, and it relies on their understanding of the word that you're using. Maybe you've noticed with your child, if you just give them a simple command and you just say the words with nothing else, such as go get your shoes, that there's not a response. But if you tell them, go get your shoes, and you exaggerate the word shoes, and you're pointing to the shoes and indicating to them in some way what you're talking about when you tell them to go get their shoes, that they do it that way. And that's because maybe they're understanding what you're doing and what you're showing them and pointing towards with them, rather than just understanding what the word shoes is when you just say it with no other indications. So again, not understanding words completely could be a reason or contributing factor to why your child isn't saying words yet. Number 4 is if it seems like your 18-month-old isn't quite interested in people yet. It's the interest and motivation to engage with others that fuels a child's first words. If your child doesn't even seem to make a noise like smacking their hand on the table or turning on their voice to get your attention, or respond in some way when you play peekaboo and other social games like this, then they might need some extra help working up their engagement and their attention skills. And this is something that you can work with your child at home on, and something that speech therapy will help with. Number 5 is if your 18-month-old is babbling, but not yet talking and saying clear first words yet. So by the time a child turns 18 months, we would expect them to have a growing vocabulary of words. And this doesn't mean that we would expect them to say these words with 100% accuracy when it comes to articulation, but it's just that their productions of the words or the way that they say them is pretty consistent, and we know what they're trying to say. If your child is only babbling with no clear and consistent attempts at words, then this could be a sign that they have a speech or language delay. It's a good sign that they are babbling and making sounds, but at 18 months, this is a sign that they may need some help forming true words. This will help them communicate their needs more clearly and may help reduce some frustration when it comes to communication. Number 6 is if your 18-month-old just grunts, points, or leads you to what they want. Even if you're not able to understand every word that your child says at this age, it's important that they're still using more words or word attempts than just pointing and grunting to tell you what they want. At this stage, you want to look for them to at least babble and make sounds as if they know what they're talking about and what they're trying to tell you. If they only ever grunt, point, or lead you to what they want, then this could be a sign that there's a delay in their communication skills. Number 7 is if your 18-month-old doesn't copy you. Imitation will be a crucial sign for learning to talk and say more words. First, a child will learn to copy our gestures, like waving or clapping, and then a child will learn to copy our sounds and our words. If a child is not trying to imitate your sounds and words at this point, this can be a critical sign of a potential speech and language delay and an indication that they may benefit from speech therapy in order to improve this crucial skill. Number 8 is if your 18-month-old doesn't say a lot of sounds clearly. If your child doesn't produce early consonant sounds, this could be a sign of a potential speech or language delay because these are the sounds that children first learn to say, even just in babbling. Some of the first early consonant sounds are sounds like for the letter M, for the letter P, B for the letter B. And if you notice, these are all the sounds or some of the sounds that children can see. They can see our mouth make them. And so that is just one reason why these are some of the first sounds that children learn to say for themselves. So if they're just saying vowels and they're not yet saying these early consonant sounds, T and D are 2 additional early sounds, then this could be a sign that there might be something more going on. Number 9 is, of course, if your 18-month-old isn't talking yet and they haven't said their first words yet at this point. At the time a child is 18 months old, we listen for and expect them to be able to say at least 20 words. Understanding how many words a child should be able to say at each developmental stage can be difficult to remember. And also being aware of some of the foundational skills that come before these checkpoints, such as 20 words at 18 months, can be extremely helpful to know because it helps make sure that your child is set up for success and they have a good foundation in order to learn their first words. So because of this, in order to help you, I made a free roadmap of communication from birth to 5 years old so that you can know exactly what to expect and understand the big picture of communication from when your child is born all the way to when they're entering kindergarten. You can get this for free down in the description below. Number 10, because you as the caregiver always know best, it's just if something in your gut tells you that something is off. Sometimes we just have a gut feeling about something, and if you do, it's important to reach out and get the extra support that your child may need. And please don't forget that if you are worried that something may be going on and your child may have a speech or language delay, please don't forget to get your child's hearing checked to ensure that they are hearing all the words and sounds in their environment in order to start using them themselves. If this video was helpful to you, then please consider subscribing so that I can make more videos just like this to help families just like yours.